there, I'm Heather Gill, local realtor with eXp Realty, and today I am talking with Lori Vann. She's the owner of Vann and Associates, and they do coaching, consulting, and counseling. And Lori, I appreciate you being on so very much.
You are very welcome. Pleasure to be here.
We had this question come through Texas Elder.care, and the question is this. This is a good one. I can't wait to hear what you're going to share. Is thinking about death always a bad thing?
I think you have to look at context of it.
Okay.
So there's a difference between being proactive versus reactive in regards to thinking of the inevitability. We're all going to pass from this world. No one, gets to live forever.
Right.
At some point, we shuffle off the mortal coil. So being proactive and thinking, do I have a will in place? Do I have a do not resuscitate? Do I have a lot of things taken care of?
Right.
Are there any loose ends in the emotional sense of closure with people that maybe you've had disagreements with in the past?
Right.
But that's not such a bad thing. Now, when you're in poor health, you may think of death more often and seeing it as a relief from whatever the medical burden may be. And that's where we really want to monitor that, because that becomes a risk factor for suicide. And we have seen research, we do know that individuals with chronic medical conditions are at an increased risk of having suicidal thoughts and even attempting.
Wow.
So we do want to really discuss with the person and understanding where are they in that process. So oftentimes when I'm doing an assessment at my counseling practice, I say, well, there's a continuum of suicidal thoughts. And I think at some point in our life, we all have passive thoughts. You don't escape this world without trauma. I mean, hello, 2020 is a perfect example of that. We've all been traumatized in some form or fashion by what's taken place.
Right.
So everyone has some type of trauma. And during those times, we might have the passive what if, and it never moves beyond that.
Right.
But when individuals, if they're chronically ill, they might start to think of well, how would I do it? Yeah. Okay, now we've got some flags going up, and that's where intervention is needed for counseling.
So, Lori, you make some good points here about, there's a difference between just kind of having a moment, and just having those fleeting thoughts in your head. And we've all had that, versus just kind of dwelling on it and thinking about how would that happen. And knowing the difference and then knowing where to go if you need to have some assistance in that area, super important. Not just for yourself, but gosh, for, your family members, because maybe mom and dad are older, maybe they're chronically ill. The sign, you hear them talking, like you can kind of see and sense, I think. So this is where you and your team can help a lot, and their numbers there on the screen, as well as their email. And definitely reach out if you've got somebody who's dealing with this, or maybe if you are, because they can definitely help you kind of sort all that out, kind of untangle it, and take the next step in your life, and just kind of move forward. So definitely worth giving the call for this kind of thing. Lori, I thank you so much for your time here.
Very welcome.